Hi everyone, my name is Mark Bates. I'm a metabolic health coach, and today's topic is the iodine crisis. A silent deficiency affecting nearly everyone is a pressing issue that demands our attention. Shockingly, most doctors never test for it. According to testing from Dr. Brownstein's practice, and Dr. Brownstein is an author of over 15 books. He's got a couple on iodine, iodine, why you need it and why you can't live without it, and a holistic approach to viruses, pretty well known. In his practice, over 97% of the patients that he tested are iodine deficient, with the vast majority being severely iodine deficient. This isn't a minor nutritional oversight, it's a fundamental health crisis hiding in plain sight. Iodine just isn't for thyroid function. It's a fundamental element for every hormone in your body. Every single hormone requires iodine for production. Your thyroid, ovaries, testes, pancreas, adrenal glands depend on adequate iodine to function correctly. When levels fall, your hormonal orchestra plays out of tune because they're not producing what they need. Iodine levels in the American population have fallen approximately 50% over the last 30 to 50 years. During the same period, we've witnessed an epidemic rise in thyroid disorders, breast issues, and other glandular problems. The negative association directly challenges the conventional medical notion that iodine causes thyroid problems. The evidence points in precisely the opposite direction. What happened? A critical shift occurred around 1970 when iodine was removed from bread and bakery products and replaced with bromide. This change correlates directly with the rise in thyroid disorders and other glandular issues. The standard medical response to this crisis has been inadequate. The RDA for iodine, 150 micrograms, was established merely to prevent goiter, not to provide an optimal level for whole body health. And that's one of the things I talk about a great deal. When you get test results or you look at RDAs for what you need, those are not designed for optimal. Those are designed for the minimal typically required for optimal health. Let's talk about the bromide problem. Bromide is a toxic halide that competes directly with iodine for receptor sites. What that means is that in each cell, there's a receptor site that allows iodine in. Bromide fits in the same one. And if you have a lot of bromide in your blood, then they will actually take the place of iodine. You're eating iodine as a supplement, let's say, it may not be getting to the cells because the bromide's getting in the way. Bromide is everywhere in modern life, as we talked, in bread and bakery products as a dough conditioner, right? In vegetable oils that a lot of people are using a ton of. Fire retardants found in furniture, mattresses, and clothing. I know you're not eating your clothing and your furniture, but it's still there, and dust gets in the air and gets into your food. Medications and soft drinks. This toxic element displaces iodine in your tissues, particularly in the thyroid, breast, ovaries, uterus, and prostate, and other glandular tissues. When these tissues become iodine deficient, they develop abnormal architecture, leading to cysts, nodules, and eventually more serious conditions. Okay, one of the most persistent myths in both conventional and even natural medicine is that iodine supplementation worsens autoimmune thyroid conditions, Hashimoto's thyroiditis. This belief stems from observations that Hashimoto's disease was first described after the introduction of iodized salt. Iodized salt, we start seeing Hashimoto's. The problem is this correlation doesn't equal causation. The evidence tells a completely different story. As iodine levels have fallen over the past 5 decades, Hashimoto's and Graves' disease, both thyroid issues, have increased dramatically. This negative association directly contradicts the idea that iodine causes these conditions. In fact, Dr. Brownstein, in his clinical experience, says that there's even a more compelling story. His daughters, both diagnosed with raging Hashimoto's disease with high antibody titers, saw their levels normalize after iodine supplementation. So this challenges the conventional wisdom that people with Hashimoto's should avoid iodine. Once again, if you have Hashimoto's, work with your doctor, but you may have to talk to them about iodine supplementation and even provide them with some additional material to read to catch them up on what's new in this field. The truth is that iodine deficiency may significantly contribute to autoimmune thyroid conditions. It's a good question. So once again, we talked about the fact that the conventional recommendation of 150 micrograms daily is completely inadequate in our toxic world. Dr. Brownstein recommends 25 milligrams. That's 25,000 micrograms for most adult patients, especially those with glandular issues. 150 micrograms is what is recommended as the minimum. He's saying optimal, go for 25 milligrams. This dosage is significantly higher than conventional recommendations, but aligns with the amounts used successfully in clinical practice for treating various conditions. Do not self-diagnose. If you're having a glandular problem, go to your doctor and talk to them about should you supplement with iodine. Okay? Children obviously need smaller amounts, but their requirements increase at puberty, particularly for girls. The development of breast tissue requires significant iodine, and deficiency at this critical time may contribute to problems later in life. Pregnant and lactating women have even higher requirements, as iodine is crucial for fetal development and is concentrated in breast milk. Okay? The salt connection. When supplementing with iodine, unrefined salt is crucial, as it helps the body detoxify from bromide. The chloride in salt binds to bromide in the bloodstream and carries it through the kidneys. This is why some people experience detoxification reactions when starting iodine supplementation. These symptoms aren't caused by the iodine itself, but by the release of bromide from tissues. Refined table salt won't do the job. It lacks the full spectrum of minerals found in unrefined salt and contains additives, ferrocyanide and aluminum silicate, which can be problematic. Unrefined salt examples include Celtic sea salt, Redmond's real salt, and true Himalayan salt. Okay? Remember, a lot of Himalayan salt is actually just dyed pink. It's not actually mined in the Himalayan mines. These contain trace minerals that support overall health and aid in detoxification. Forms of iodine. For optimal results, supplementation should include both iodine and iodide forms. Different tissues in the body respond to different forms. The thyroid gland primarily takes up iodide. The breasts also utilize iodide. Other tissues like stomach, pancreas, and ovaries may respond better to one form. Lugol's solution, which is a very prominent supplement you can buy. It's very inexpensive. It's been around since the 1820s. Provides a very good whole body coverage due to its comprehensive nature. It's a popular choice for iodine supplementation because it contains both iodine and iodide in a good ratio. Additionally, besides the liquid form of Lugol's, there are tablet forms you can get of iodine supplementation. Supplementation with iodine should be relatively inexpensive and easy. Contrary to popular belief, painting iodine on the skin is ineffective for supplementing or even testing for deficiency, because 88, almost 90% of the iodine applied to the skin sublimates. It evaporates into the air, and you're never going to get any of that into your body. So you don't need to do that. Beyond iodine, let's talk about some other nutrients you need. While iodine is crucial, it's just one piece of the puzzle. A comprehensive approach to health, including other nutrients that support iodine metabolism and reducing exposure to toxic halides, can help us take control of our well-being. First is selenium, which helps protect the thyroid from oxidative damage during hormone production. B vitamins, particularly B2 and B3, which support energy production in the glands. Magnesium, a cofactor for numerous enzymatic reactions. Vitamin C, which supports overall glandular health. Additionally, reducing exposure to bromide and other toxic halides can help maximize the benefits of iodine supplementation. Now, in your cells, the receptors, we talked about receptors with iodine, the receptors for vitamin C are exactly the same receptors used to bring carbohydrates, glucose, into the cell. For those already taking thyroid medication, using iodine supplementation may reduce the need for medication over time, but talk to your doctor. Don't self-diagnose, don't make changes without talking to your doctor. And if your doctor disagrees, you may need to provide them with some additional material on iodine, which they can read to get caught up with. Once again, leave me a message, and I can help provide that information for you. Dr. Brownstein has reported that after implementing iodine therapy in his practice, patients' average natural thyroid hormone dose decreased from 120 milligrams to just 30 milligrams. So they were able to reduce the amount of medication they were taking dramatically. This suggests that many cases of hyperthyroidism may be primarily driven by iodine deficiency rather than inherent thyroid gland failure. But once again, do talk to your doctor before you change your medication. When starting iodine while on thyroid medication, monitor for signs of excess thyroid hormone is essential, as your body's natural production may increase. Working with a knowledgeable healthcare provider can help manage this transformation safely. Okay, finally, the evidence is clear. Iodine deficiency is widespread, contributes to numerous health problems beyond simple thyroid dysfunction. The declining iodine levels and increasing bromide exposure create a perfect storm for glandular dysfunction. Contrary to conventional wisdom, appropriate iodine supplementation may help resolve rather than worsen autoimmune thyroid conditions. For most adults, a daily dose of 25 milligrams of combined iodine and iodide, along with unrefined salt and supporting nutrients, can help restore optimal iodine levels and improve overall health. The key is working with a healthcare provider who understands iodine's role beyond the thyroid and can help implement a comprehensive approach to restoring optimal levels. In a world where our exposure to toxins increases while our nutrient intake decreases, addressing iodine deficiency may be one of the most essential steps, and very inexpensive steps, by the way. Lugol's is very inexpensive for long-term health. If you like this and you want more information, please like, subscribe, hit the bell button so you get notified every time I post a new video. Thank you very much.